Hi, everybody. I'm Robert F. Kennedy Jr., your HHS Secretary, and I'm here today with NIH Director Dr. Jay Bhattacharya and FDA Commissioner Dr. Marty Makary. I couldn't be more pleased to announce that as of today, the COVID vaccine for healthy children and healthy pregnant women has been removed from the CDC recommended immunization schedule.
All right, so that was the big announcement earlier today from Secretary Kennedy. He called that move, which he just described, common sense and good science. Let's see what Dr. Chris Pernell makes of it as she joins us now. Welcome back, Doctor. Is it common sense and good science to not be giving the COVID vaccination to healthy children and pregnant women?
This is an emphatic no, Connell. What we are seeing happening in the United States is the decimation of the public health infrastructure and a decimation of public health science and how we approach decisions, recommendations, and guidelines. For those who voted in favor of Secretary Kennedy, this is exactly what he hoped to be able to do. We continue to undermine the confidence in safe and effective vaccines, and we continue to question or have people speculate whether or not vaccinations are necessary. What is not happening is a mandating of vaccines. That's the premise that some have sent misinformation and disinformation around. The availability would mean that should you and your physician have a conversation and look at the benefit versus risk profile, that vaccine should be available for you. And this is a mistake.
Well, that's interesting you bring that up, because I think that is on an individual basis. Like, for example, I got my physical, the annual physical, maybe, I don't know, 2 or 3 months ago. And I did have a conversation with my doctor. And obviously, I'm in neither one of these classes that we're talking about today. But he says to me, well, I'm 47 years. He says, you're 47, you're healthy. No, that, I don't think you need to have this these boosters anymore. If, for your parents or people that are older, I would recommend it still. But for you, I don't think so. That's what he said to me. So that was an individual conversation. Is that what you're recommending, or?
Sure, you should have that individual conversation, but this is the distinction I want to make for the public. When the HHS secretary or the federal government say that these vaccines are not necessary, it means that it's less likely that insurance would cover the vaccine. So it's less likely that you would even have a conversation about whether or not you get the vaccine with your provider. And the onus would fall on the individual or the patient to advocate for themselves to see whether or not they could find a vaccine. Is it available at a price that they could afford? And that should not happen in the United States of America. Let me mention this. There are nearly 6 million children as of 2024 who were living with long COVID. The COVID pandemic has been a mass disabling event. 17 million adults in the U.S. and nearly 6 million children. There are children who live with high-risk adults in their household. Those children most likely should be vaccinated. Anyone to prevent them from developing long COVID, that is a benefit. And we know that in pregnant people, if you get exposed to COVID and you become infected with COVID, not only are the risk for you to have more severe outcomes of coronavirus, but the risk for preterm birth, the risk for stillbirth, the risk for preeclampsia, and the risk for C-section increases.
So not a one-size-fits-all necessarily, in all of these cases. Okay, one other story that came out today, or, the president actually mentioned it, I believe, on Inauguration Day, that the United States would be leaving the World Health Organization. But Kennedy and company at HHS have made it official today, and apparently the plan is to kind of go in and do our own thing, along with Argentina, which has a libertarian president, Javier Milei. What would you say about this?
This is a political decision. This is not a decision rooted in public health. This is not a decision rooted in the health and well-being interests of all Americans, nor of citizens and people across the globe. Diseases don't recognize boundaries or borders. You need collaboration across different countries, across different regions, so that in the case where there are infectious disease outbreaks, they can be mitigated, they can be managed before that we begin to experience something like a pandemic of COVID, which we had in these past 5 years. This is a sad day. Those of us who practice healthcare or work in healthcare, our enemies are not in the WHO. Our enemies are not in other of our peers across these nations. We know that science is only encouraged and flourished and vibrant in an atmosphere where there is cooperation, collaboration, and partnership.
All right, Dr. Chris Pernell, as always, thank you for joining us.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.